Hello and welcome to another episode of I in Immunology. Today our topic is renal transplants. So you're probably asking, what is transplantation? It is defined as the process of taking an organ or living tissue and implanting it in another part of the body or in another body. There are four main types of transplants. Firstly, there are autograft transplants, where tissue from another part of your body is transplanted or moved to a different part of your own body. An example of this would include grafting your own skin from one part of your body to another to treat burn wounds. This is quite common. Next, we have isografts, where transplantation of tissue or organs comes from an identical twin or monozygotic twin. These are less common. Allografts, which are the most common type of transplant, are where you receive an organ transplant from another person, not necessarily an identical twin. This is where kidney transplantation falls under this category. And lastly, xenografts or xenotransplantation involves an organ or tissue transplant from an animal such as a pig or dog into another animal or human. The goals of transplantation are simple. We want to be able to cure the disease, and in doing so, we aim to prolong life. For example, extend a person's life from, let's say, hypothetically, from 40 to 60 years old. If we can't do those things, we want to at least improve the quality of life. Think about how many times a week you need to come in for dialysis. Life would be so much easier if a functional kidney could be transplanted into you and allow you not to depend on dialysis. To put you at ease, kidney transplants are part of the many different type of organ transplants out there. For interest's sake, I will list a few of the common ones that have been successfully performed. Firstly, we have the heart transplant, lung transplants, liver transplants, pancreas transplants, cornea transplants, which are routinely done but severely undercredited as a transplant, and lastly, bone marrow transplants. So, apart from the inconveniences of dialysis, why do people need kidney transplants? Well, 1 in 10 people in Australia suffer from chronic kidney disease. In 2016, 12,706 people received dialysis. Chronic kidney disease progresses in stages. When a person reaches end-stage kidney disease, the normal role of the kidneys is compromised, leading to a waste buildup in blood, making you feel sick. You can also develop complications such as high blood pressure, as well as low red blood cell counts, weak bones, and nerve damage. Kidney disease also increases your risk of heart and blood vessel disease. A transplant for end-stage kidney disease is therefore a treatment but not a cure, potentially offering a longer, more active life free from dialysis. 53 people die each day from kidney-related disease and is the 10th leading cause of death in Australia. Now you're probably wondering, what is the impact of transplants on society? Currently, there are 11,133 Australians living with a functional kidney transplant. Kidney transplants extend the life of the individual and have high survival rates. The average cost of receiving dialysis in hospital is almost $80,000 per person. This money is coming directly from the taxpayers' pockets and is a big society issue that can be addressed through transplantation. In order for the kidney transplant to be successful and avoid rejection, pre-transplantation assessment is crucial in finding the right kidney for you. This usually involves matching your blood group type as well as matching specific sequences in your genes called human leukocyte antigen, abbreviated to HLA. Let me explain these concepts a bit further. In ABO blood type matching, the donor blood must match with the recipient blood. There are 4 types of blood groups: A, B, AB, and O. AB are considered the universal acceptors, whereas A blood type is considered a universal donor. This means that O blood group can be donated to A, B, AB, and O, whereas O can only accept blood from other O groups. Whereas in blood type AB, they can accept blood type from A, B, AB, or O blood types. If there is a mismatch in ABO blood types, there will be agglutination or clotting that occurs. In contrary, if there is a match, no agglutination occurs. Agglutination occurs due to small molecules called antibodies present in the recipient's serum or blood that recognize foreign particles such as the donor's cells or blood. If there is a mismatch, antibodies to the donor's blood will attack and cause agglutination and inflammation. ABO blood group matching is not as important as human leukocyte antigen or HLA matching. The success of a kidney transplant will depend more on whether or not HLA is matched up. HLA is encoded for on one of our chromosomes, chromosome 6 to be more specific. Here, there are particular areas on the chromosome called alleles that encode for HLA. HLA has incredible polymorphism, which means that any particular individual of a population will express different HLA compared to others. For example, if we look at two mice, A and B, they will both pass on a part of their HLA subtype to the offspring. HLA cross-matching aims to match the recipient and donor subtypes as closely as possible to prevent rejection. There are various tests that are used via a computer to ensure that the best match occurs. So you're probably asking, what are the consequences if we don't match properly? Well, there are various types of rejections that can occur. Our first type is hyperacute, where rejection of the newly donated organ can occur within minutes to hours of transplantation. We also have subacute rejections, which don't occur as quickly as hyperacute rejections, but can occur days to weeks after transplantation. Next, chronic graft rejections see failure of the graft months to years after transplant. This type of rejection is typically associated with poor medication compliance. And lastly, we have graft versus host, where the immune cells in the new kidney recognize the recipient cells and attacks. This can occur anywhere from days to weeks. The success of transplantation relies on immunosuppressant medications. Some of the common ones you will encounter are steroids, such as prednisolone, azathioprine, cyclosporin, as well as tacrolimus. All medications have side effects, and these medications are no different. Some of the side effects may include increased risk of infection due to immunosuppression, fluid retention, as well as increased blood pressure. However, the good news is that by taking a combination of different medications, side effects can be minimized as dosages used are much lower. Again, I should reiterate that medication compliance is extremely important in maintaining the transplantation and reducing the risk of rejection. A few other precautions should also be taken. Ask your doctor about vaccinations and antiviral or antibiotics that you may need to protect yourself against infections. These infections may either arise from the transplanted kidney or from opportunistic infections due to being immunocompromised. There is good news to kidney transplantation. Kidneys can come from live donors or recently deceased donors or cadavers. Both show promising long-term survival rates, with kidneys from live donors performing slightly better. 97% of recipients from live donors are still alive after 5 years. Despite the benefits from kidney and organ transplants, there are still long waiting times for people in need of a kidney. Average waiting times range anywhere between 3 to 7 years. In the meantime, they must undergo dialysis quite frequently. Luckily, less than 1% of people die on the waiting list. There are complex allocation systems that take into account transport logistics and various other factors such as urgency. In Australia, there were 995 people waiting for a kidney in June 2018. Organs are allocated fairly without any bias and not dependent on race, religion, gender, social status, disability, or age, unless age is relevant to the matching process. Currently, there are donor programs that utilize worldwide registries to establish donor and recipient matches quicker than ever before. There is also a paired kidney exchange where multiple people undergo kidney transplantations to ultimately allow those in need of a kidney to receive one quicker than traditional methods. But this is not enough. Waiting times in Australia are still too long. If society is to improve our current waiting times, organ transplantations should follow other countries such as England or America and adopt an opt-out system rather than an opt-in system. This means that rather than waiting for people to sign up for organ donation, people, by default, will donate their organs in event of death. Education of people about the importance of organ transplants through social media outlets such as YouTube, Twitter, as well as Facebook will be pivotal in addressing transplantation waiting times. I hope this short video was beneficial to your understanding about kidney transplants. Thank you.